We are continuing our coverage on the impacts of the corrections officer strike in New York State.
More than 2,000 officers were fired after the unsanctioned walkout. A major point of contention is still the implementation of the HALT Act. The state law restricts solitary confinement and mandates specific mental health protections within prisons and jails.
NBC5's Erica Love is at Essex County Jail with more on where these mental health efforts stand in our county jails.
Well, we're seeing the HALT Act have trickle-down effects across the state. I spoke with officers in the Department of Corrections just to see how it's affecting their daily experience.
I think everybody incarcerated is considered in the vulnerable population because of what we are exposed to.
The language in the HALT Act describes incarcerated people living with mental illnesses as, quote, vulnerable populations. Those who'd like to see HALT repealed say the term is too arbitrary.
I have no doubt that there's populations that are incarcerated that have mental health challenges. Now, with that said, there's also people that have had those same challenges and have managed not to break the law, not to harm their neighbors.
It seems like the only place New York State can figure out where to put people with mental health issues is in jail, and it's not the place for them.
Jails are not the place to put people with mental health problems.
Sheriff David Reynolds at Essex County Jail says addressing mental illness is more complicated than the state realizes, particularly when it comes to the wide range of individuals who could be held at the county jail at any given time.
This is what the HALT Act would refer to. They're all empty because we can't use them. When you have one person that takes up 6 beds because they can't be around anybody else, whether it be their mental health status or if they're violent. But we also get our local inmates, people that are in for traffic sometimes or family court offenses. Everybody kind of lumps corrections together, but as a local correctional facility, we get anybody that goes to state prison before they go to state prison. Nobody just goes to the state.
Clinton County Sheriff David Favreau says abuse in prisons before HALT was inexcusable.
I think most people would agree that locking somebody up in a cement box for 23 hours a day for years on end is inappropriate. That's not a way to be able to reform any human being. You create a bigger problem.
But at the same time, he believes there has to be a better way to address the issue.
I can't tell you the manipulation that goes on in a jail. The unfortunate thing with all of that manipulation that goes on is the people that really suffer from that are the people that have the true mental health or medical needs. Because now the broad scope is, well, they're all faking, they're all lying, and that's not true.
Under the current policy, the only individuals eligible for confinement are those between the ages of 21 and 55 and without any mental health diagnosis.
The definitions that the state uses are open to interpretation because part of it is they talk about mental illness, mental health issues, but they don't really define it.
Local sheriffs say because of budget restraints, they're forced to choose between hiring mental health professionals while struggling with an officer shortage.
Like overtime is rampant.
Here in our jail, I can clearly say the best person to assess a vulnerable population is my officers. They're standing there, they're talking to these people one-on-one, they're listening to conversations that these people have. They can understand a little bit more of the roots, why they're here, how they got here, who visits them, who doesn't visit them.
There's a lot of people in the jail that are helping support individuals' mental well-being. So we have to work together with any provider that can help support the psychological well-being of an incarcerated individual.
The act restricts segregated confinement to a maximum of 15 days. It also limits isolation to 17 hours in cells and provides all-encompassing rehabilitative programs. This is not always feasible for county jails due to staffing and cell capacity. They say it's not a one-size-fits-all solution.
The standards, the time sentencing, everything is totally different. But
we're being punished for mistakes that other places have made. It makes it difficult because what fits in Essex County does not fit even in Clinton County.
And Sheriff Reynolds mentioned that better funding and listening to the feedback coming directly from corrections officers is what he believes will actually turn the tide with the HALT Act here in New York State. At Essex County Jail, I'm Erica Love, NBC5 News.